My name is Tim Ria, host of Informed Health 2016 here in beautiful San Francisco at UCSF. We have a special guest today who's an exhibitor and also has a really cool display here at the new hospital. And your name is Metin Necar, CEO of Ouva, O-U-V-A.co.
CO.
Cool.
Ouva. So Ouva is basically a wellness technology company. Yes, that's our brochure. So we design interactive installations. We design these experiences mainly for hospitals and clinics to promote healthy behavior, so promote health and wellness. So the experiences we design is mainly, we've been doing a lot of installations at children's hospitals, over 15 hospitals in the United States. So we have a giant bubble wall at the new Mission Bay Children's Hospital here. So yeah, the bubble wall is actually the way for patients, kids to contribute to the space by making their own shapes by using their bodies. So the whole idea, we collaborated with the UCSF team on that and the architecture firm to turn the control over the kids, patients, because when they come into a hospital, they're anxious, nervous, and they don't really have much control. So the stuff we do is mainly to relieve stress and anxiety, as well as empower patients. So stuff we do is very visual, but on the back end, we also collect a bunch of data, useful data. So our experiences are usually motion controlled. We do use IR cameras. A lot of Microsoft is one of our partners. We do utilize Kinect cameras, Kinect motion cameras. So the data we collect range of motion, skeletal data, joint rotations, as well as dwell times, how much.
The new Kinect also has like heart rate. It can do. You learn video magnification and basically emotional states and stuff like that. The new SDK is coming out. Is that pretty cool?
Yeah, there are some features, like facial recognition and stuff like that. So that's sort of the next step for us. We collaborate with the researchers over at UCSF to utilize this data in order to identify, figure out the user behaviors, and also utilize this data to help physicians and doctors. So doctors been telling us, we've been actually working closely with physicians. They've been telling us they can tell a lot from just kids interacting with these displays. Stuff like
It's okay. So what I'm looking at here in your brochure is you guys have a really cool system to collect data and create a really interactive experience, and you're kind of blending technology. The question I want to have is, how has your partnership with UCSF enabled you to focus and develop your model in this healthcare space? And what's your kind of goal with innovation and providing a new experience?
Yeah. So our company's coming from a engineering and design background. So we definitely need our healthcare partners' knowledge, their help, collaborations, in order to utilize our technology and design skills for healthcare. So it's a partnership where they're bringing their expertise and knowledge in healthcare, we're coming from a patient engagement background, and we do design very visual experiences, social experiences that brings people together. and motivates them to, do stuff. Whether it's motivate them to move around or promote stillness, calmness, and relaxation.
It's interesting because the environment and the healthcare systems are, I've been to LA County, these older school facilities to cutting edge ones right here in UCSF. And it's just dramatically different when I go into the UCSF and I see this huge video wall. And then all of a sudden I'm interacting with it. So my mindset is completely different than going into kind of a colder, sterile environment, which I kind of expect in the hospital space. So you guys are working to make things fun, interesting, but also get bidirectional data and make it an interactive experience.
Yeah, so it's all about the hospital experience. That's what we want to improve, and our design is our goal is to promote, health and wellness. So we're specializing in creating these wellness spaces. As well as the overall hospital experience design.
What does the dashboard look like for the hospitals, and what are they trying to get from, I guess, the data interactive? Do you see like a timeline, and how is that data used, and how does it change the experience for the guest, the client, the customer, the person seeking healthcare?
Yeah. So right now there's a big switch in personalized care, personalized data. So the next step for us is to tie the experience with personal information. So if you can tie the data with an ID, we can sort of provide a very personal experience for each patient.
So you're using wristbands with tags in it, so basically near field communication, a trigger ID, and then I can say Tim or...
Yeah. We actually done this project with Kaiser Innovation Center that is a smart patient room. So it basically tracks patient ambulation in the room, as well as all the other people that enters, like doctors, nurses, who they do have RFID tags when they come into a room, and then we have a camera that tracks them, and it is tied with their IDs. So the goal for that project was to, we can actually detect how much patients are moving in the room, as well as their behaviors.
Down to each individual.
Down to each individual, yeah. And when they're in a hospital room, they're mostly, lacking the motivation to move around. And there's some certain, exercises and stretches that they have to do. And that was the experience we created for them, where we motivate them to get up and move around, as well as doing the stretches in a way that is not really a big hassle for them. Doing it with this engaging experiences, interactions. For example, if you're into yoga, then a yoga instructor might come up and kind of train you or help you to do those exercises.
Cool. You're a startup. What are you looking for in terms of outreach to the community, support, in your stage of growth?
Yeah. Well, it's definitely it's a iterative process. We're actually conducting case studies on these experiences right now with the help of our partners. So next step for us is to how we can quantify these benefits, how we can utilize this data and make it useful for physicians and doctors in order to enhance these experiences, and as well as helping out doctors to do better assessments.
It sounds really interesting and cool, a little bit outside of the box, but definitely could benefit in terms of just the mindset coming in and out and all the different data points you can collect. How do people connect up with you? What's your website?
Well, our new website is www.ouva.co. It's OUVA. You guys can find me on LinkedIn, Twitter. My name is Metin Necar. And my email is metin@ouva.co.
All right, well, nice work. I'm going to have to go over again and see your latest work at the new center here.
Come check out the wall. We're exhibiting this living garden experience here on a kiosk. It's pretty cool. Hope you can stop by and check it out.
Okay, and thanks, Einar, for supporting entrepreneurs like you. Has that been a good experience?
Yeah, Dr. Sawyer is one of our biggest supporters, and we're so grateful for her help and collaboration.
All right, well, my name's Tim Maria, and that was Metin Necar, COO of Ouva, one of an exciting entrepreneurs here who are kind of putting things into action and putting smiles on people's faces.
We're trying to.
Great. Well,
Thank you.
Thank you. Cheers.